All right, so welcome back to the StartStrong Series, everybody. I'm Adam Walder, and I'm here this week to talk to you about exercises that you can do, sort of stretching and mobility exercises to help reduce lower back pain. So movements particularly revolving around the hips and around the legs. So we're going to get going with that in just a moment. Again, if you get the chance to hit that subscribe button, hit the like, give us a thumbs up, that would be jolly lovely. And in the meantime, let's get cracking. So let's get you started, everyone. So what I want to try and do is start you off lying down onto one side. All right, we're going to work through the front of the thighs, so your quadriceps here first. All right, we want to start off just lying onto one side with your lower arm underneath your head, or you can use a block or two of those if that feels a bit more comfortable. We're going to try and keep the hips stacked directly on top of each other. We're going to bend at your top knee. We want to have the knees on top of each other. We're going to try and bend at that top knee and reach around towards your leg. Now, if you can reach around the front of your leg, that's brilliant. If not, you can take a hold of your trouser leg or anything like that as well to try and just keep that stretch in there. I'm just going to hit the timer button here. We're going to do a minute of this one. We're pulling that leg gently in, but I want to keep the knees together, squeeze through your bottom, and then push the hips just forward a little bit there, and you should feel that stretch down the front of your thigh. Now, again, depending on how tight you are here, you might find that this actually feels like being on holiday and it feels quite nice. Some of you may feel like you're in hell. And either or, just enjoy it. Just sit back and love this, have fun with it, and enjoy yourself. So, big deep breaths on it, breathing in through your nose, breathing out through your mouth. Just remembering to enjoy the overall experience and have fun with it. And just stretching out. And the reason I wanted to try and release out some of this area particularly is the way it relates into your pelvis. So it can cause a bit of an anterior pelvic shift, which is where your pelvis shifts forwards, overarching your lower back. Because of where the quads sort of originate and everything, it's all about just trying to release that off. A lot of times people do well at stretching out through their back, but they don't do enough for their front. So I'm going to release out through there. Now, that's 1 minute. We're going to be doing a minute of each stretch here. But what I am going to get us to do, just before we go over to the other side now, is come over onto your back, and we're going to look to stretch through your bottom. So into your glutes, what's called your piriformis. We're going to go with knees bent, and the leg you were just stretching there. So I had my top leg there. I'm stretching that leg for my quadriceps. Now we're going to come over and do the same leg, but I'm going to bring the foot over the top of the other one into a figure 4 stretch position. All right, so I've got the bottom knee bent, top leg comes over. Now, again, depending on where you're starting from here, you may find this is enough and you feel like there's that stretch there already on that side. You can push the knee gently away a little bit if you want to. Now, if you want to try and do that, you certainly can do. Now, with this particular one, for some of you, if you've had anything like a hip replacement or stuff like that, these might not be the best exercises for you to do. Always check with your doctor before you do any of these. So again, if that's not enough, you can take the lower leg up off of the ground and hold that there as well if you want to, and just have the arms down to your side. If that's still not enough, you can also reach through the gap in between the legs there and just grip on to that lower leg and help just pull it in a little bit. All right, and that should really feel quite nice through your bottom there. So again, 1 minute of these now. We're just going to hold you there in a nice strong position and big deep breaths. You can also play with the positioning side to side a little bit. So if you lean outwards a little bit, you can find that that really pulls a bit tighter. Just finding any corners or any positions where you feel a bit stiff. So big deep breaths. Just thinking of a happy place. And let's just hang out here for a minute. So again, like I say, it's a minute on each of these stretches, and then we're going to swap over and do the other side in just a second. So we'll come back to it again in just a minute. And again, it's all about just trying to find anywhere that we do feel a bit stiff. So you can move around in it a little bit. Like I say, lean out a little bit more to the side. That can really make it a lot worse. And just find where we feel a bit stiff. All right. So again, once we've done the minute on that side there, then we need to swap you over. So again, I need to just take off my my electronic equipment. And then we're going to come over onto the other side. So same thing. Now remember, one side might be a bit stiffer than the other, so let's just, it's like a voyage of discovery, half this stuff. So again, lower arm underneath the head, top hand out, and so you can bring yourself round. So you bring the foot round, grab a hold of it, so you can either take a hold of the leg there, or the trouser legs, up to you. But again, squeeze through bottom, push the hips forwards just a little bit, and stretch. And again, the feedback over the last couple of weeks has been that you've been really enjoying the videos, and you're particularly enjoying the stretching, the mobility exercises. So I thought, well, let's do a little bit more of that, because we can always do with some of it. Like I was saying before, it's stretching down the front is often neglected. So quadriceps, hip flexors, all of those sort of areas, they really do attribute to lower back pain. So it's an important area to stretch out. So again, big deep breaths as we stay in that stretch position, nice and strong. And we're coming up on that minute there, well done. Right, so that's a minute of that one as well, just done. Then we'll come back over again and go for that figure 4 stretch. So again, I was just stretching my right leg, so my right leg will come over the top of the left one. So we're going to be doing the same thing again on this side now. Hold on, technical difficulties, there we go, 1 minute. Right, so again, we've got the foot turned over the top. Now we can go back to the level you were just on, or if you do feel a bit stiffer on that one side, you can stay where you feel the real tension into it. But again, I'm going to reach through the gap there and try and help pull that in. So again, big deep breaths. Each time you breathe out there, it just helps the muscles relax a little bit, so you can always maybe just try and get maybe a millimetre extra stretch into it, you know, just get a little bit more out of it and just try and release off. And again, these are particularly good ones to do after you've been for a run as well. So if you're into your running or anything, or even if, you know, we were talking about cycling and stuff last week, these are particularly good to do after exercise, especially where your legs are being used heavily like that. So again, don't neglect all these muscles around the hips and around the legs there, all right? Okay, so a minute of each of those is now done. So once we've then done that, let's carefully bring you back up to a seated position. And what I'm going to get us to do from there now is just work around the hips, and then we're going to work a bit of internal and external rotation. So the way that works is that we're going to sit you up with the hands behind you. We're going to have the feet a little bit wider than shoulder distance apart. Now all I want to try and do is collapse the knees gently down and in. Now again, if you've had a hip replacement, anything like that, this one isn't going to be a particularly beneficial exercise for you to do. So again, just go nice and carefully side to side. All right? So again, we're going to go for that minute. And off we go. So I'm going to sit you nice and tall through your back. Try not to slouch. Keep those shoulders back and down. And we're just turning back and forth. Now again, you may find that you're a little bit stiff here, maybe more the one side than the other. I've actually torn the adductors on my inner thigh before now on this side. So this one in particular is really stiff for me. So it's one that I find really helps out in terms of trying to work on the mobility and the flexibility of the whole hip joint itself, especially if I'm doing anything like squatting or anything like that, any deadlifts, leg exercises in the gym, that kind of thing. These are really good to help loosen me up a little bit. Now that side there does get particularly stiff on me personally, but again, you may find that this is actually not too bad. If you find it's not too bad, you can bring the feet in a little bit more and try and go a little bit further into it. Just try and make sure you got your feet wide enough so that your knees can clear and touch the ground there, so you're not coming down on top of the other foot. Still staying nice and tall. And again, we've just come up on the minute there. All right, so we can hit the stop button and you're done. So again, that's a nice one that can be done each day, releasing out everything around here to stop any kind of lower back pain, sort of, you know, giving you any grief throughout the day. So give that a shot. Give me some feedback. Give us a thumbs up. Give us a subscribe. Have a lovely time. Have a good week. See you next time. Cheerio.